Welcome to the Infection Prevention Sustainability webinar series for long-term care clinical and non-clinical settings. This is session 2, which shows the top non-clinical citations in long-term care settings. My name is Jean Lyon. I work for Comagine Health as a senior infection prevention advisor and a consultant. For the past several years, nursing homes have been cited by state and federal surveyors for having issues with infection prevention programs and often with basic infection control measures. Even before the SARS-CoV-2 pandemic, infection prevention and control citations comprise the highest number of deficiencies in nursing homes. Today's learning objectives include being able to identify through observation circumstances that could be cited for non-compliance with infection prevention and control practices in non-clinical areas. We're going to conduct environmental rounds using knowledge gained to correct observed deficiencies in your own building. You're going to be able to identify the most common non-clinical infection control citations prior to COVID and during the pandemic. You're also going to learn to use the content of the webinar to train staff on circumstances that could be cited for non-compliance in infection prevention and control practices in non-clinical areas. Your facilitator will now pause the presentation to allow you time to complete the pre-test questions. Obtain a copy of the State Operations Manual, Appendix PP, Guidance to Surveyors for Long-Term Care Facilities for a full explanation of all the requirements. There are 4 FTAGs that are not included in the State Operations Manual Appendix PP at this time, but they can be scored. These include F884, F885, F886, and F887. It is important for your facility to know the standards and the expectations in order to avoid citations during survey. You need to have as many policies and procedures as necessary to cover all aspects of infection prevention activities in your facility. These should include how to handle, store, process, and transport linens to prevent the spread of infection, standard precautions, types of isolation, duration, and when it can be discontinued, hand hygiene, including when to use soap and water versus alcohol-based hand rub, food handling, food processing, and food storage, and your surveillance plan and process. Prior to the outbreak of COVID-19, the most common FTAG citations included infection prevention and control deficiencies, which comprised 83% of survey deficiencies between 2013 and 2017. These continued into 2018 and 2019. Many were cited in the same facilities in multiple years for violations that include poor hand hygiene, improper handling of linen, improper cleaning of equipment such as glucometers, lack of proper infection prevention measures, and lack of development of an infection prevention and control program. During the COVID-19 pandemic in 2020, the most common FTAG citations included improper use or no use of personal protective equipment, PPE, failure to practice good hand hygiene and hand washing, improper sanitation of equipment, staff allowed to work when COVID positive, staff and residents not wearing masks, and residents eating meals together when this practice was not recommended. This slide shows the most common non-clinical citations. Free of accident hazards, supervision, devices. Formerly F323, it is currently found in F689. The intent of this requirement is to ensure the facility provides an environment that is free from accident hazards over which the facility has control and provides supervision and assistive devices to each resident to prevent avoidable accidents. I would encourage all of you to look at your last survey results to see whether or not you were cited on any of these topics. Another common non-clinical citation includes food procurement, storage, preparation, and serving, and sanitary conditions. This was formerly F371 and is currently found in F812. This requires that facilities follow professional standards for food service safety with regard to storage, preparation, distribution, and serving of food. The regulation states that CMS recognizes the U.S. FDA Food Code and the CDC's Food Safety Guidance as the national standards for these topics in long-term care facilities. It is everyone's job to identify opportunities to improve the environment and reduce the risk of hazards. Now we're going to look at a few examples and see if you can identify opportunities for improvement. Take a few minutes and look at each photo, then identify with your surveyor eyes what the problem is. Each slide will be paused by your facilitator to allow you time to discuss the findings. All of these slides were taken in long-term care facilities. None of them were staged. Your facilitator will pause the slide presentation to allow you to look at the trash can and decide what the issues are. As you can see, the trash can is overflowing, the opening is on the top of the can, and trash is coming out of the side of the container. The outside of the can is dirty, and the dustpan and broom should not be stored behind the trash can. This photo was taken in a storage room and storage area. You can see that not all the bags are labeled. Bags and boxes are also located on the floor. An 18-inch clearance is needed between storage and the ceiling. There is a dirty air vent and a dirty ceiling tile. You also want to question the separation of clean and dirty items. Here we see boxes on the floor. There are old chart covers on the floor, and they're stacked up. Is there paper in the charts? Is there any risk of a HIPAA violation? There are also hanging wires along the left wall. In the laundry room, we see bags on the floor. Are the contents clean or dirty? There's a box with a plastic bag inside. What's inside the box? The tile does not extend under the washing machines, which makes it difficult or impossible to thoroughly clean the floor. The washing machine is leaking, and there's corrosion at the bottom of the machine. These items were left on the sink in a shared or community bathroom. Who do they belong to? Will another resident use that razor that is already used? There is some mold on the tile to the left, and the sheetrock on the left looks wet. This shower was not cleaned after use. The chair is not cleaned, there's mold on the floor tiles, and the red shower curtain that can increase agitation in some residents. The razors are not cleaned. Hair on the equipment and on the table surface is present. How is equipment cleaned between use with residents? And what are the cleaning protocols? There is no hand hygiene product in the dispenser. The medium-sized glove box is empty. There's no holder for the extra large box of gloves. Gloves are falling out of the extra large box. So who cleans the CPAP or BiPAP equipment? How often is it cleaned? Who changes the filter, the tubing, and the mask? How is the mask stored between uses? You must follow the manufacturer's recommendations. A So-Clean machine can be used for cleaning of the mask and the tubing if the resident owns one. The machine is not to be shared among residents. The crash cart is not labeled and looks cluttered. Are there medications on it? If so, how are the medications secured? The suction canister is not hooked up, and the oxygen tank is not in an appropriate holder. There's liquid in the pitcher. The pitcher is not labeled, and it also is not covered. The plastic wrap box next to the pitcher is open, and there is food next to the pitcher that is not covered. None of the cakes are covered, either individually or collectively, and one tray sits on top of the lower tray, and none of them are covered. Are these bananas still good? And why are they on top of other items? What is this food product? How long has it been out of the freezer? Is it safe to prepare now and serve to residents? Are the gloves on the counter clean or dirty? And the spray can is next to the oven. Puddings and salad dressings are out on the counter and they are not refrigerated. Gravy is left over from a previous meal. It is not covered and has not been kept hot or refrigerated. The top has congealed. What is the temperature? Is it safe to serve? This pasta is also left over from a previous meal. It's not covered. And how long has it been at room temperature? Is it safe to serve to residents? There are open puddings on the top of the medication cart. How long have they been there? What is the facility's policy on how long puddings can be open and not refrigerated? Are the puddings used for multiple residents? How is the pudding scooped out for use with medications? This is an immediate jeopardy situation. Repair of this problem needs to be done immediately. The fire department needs to be notified, and a person identified as the fire watcher needs to be assigned to watch for fire. Good job! The more you look around your facility and train your eyes to see situations that can be corrected and are corrected quickly, the more survey ready your facility will be. Conduct regular rounds as an interdisciplinary team at least once a month. If major repairs are needed, they might need to be budgeted as a capital budget item. These are the two F tags related to food service. F802, which has to do with staffing, having sufficient staff with appropriate competencies and skills to carry out the functions of food and nutrition service. And F812, which is food safety requirements and includes reference to storing, preparing, distributing, and serving food in accordance with professional standards for food service safety. This frog poster is a clever way to remind your staff to perform hand hygiene. These can be printed out and posted throughout your organization. FROG stands for Friction Rubs Out Germs. Your facilitator will once again pause the presentation to allow you time to complete the post-test questions. The next two slides have a list of resources that are available for your use. And this is the second list of resources. This concludes our presentation for non-clinical staff. If you have any questions, please feel free to reach out to your facilitator, or for more information, go to infectionpreventionadvisor@comagine.org. Thank you.